Febrile seizures are seizures that happen with a fever, and they typically happen in young children between 6 months and 5 years of age. Now, neurons are the main cells of the nervous system, and they're composed of a cell body, which has all of the cell's organelles, and nerve fibers, which are projections that extend out from the neuron cell body. Nerve fibers are either dendrites that receive signals from other neurons, or axons that send signals called action potentials along to other neurons. Where two neurons come together is called a synapse, and that's where one end of an axon sends neurotransmitters to the dendrites or directly to the cell body of the next neuron in the series. Some neurotransmitters bind to the receptors and tell the cell to open up the ion channels and relay the electrical message, and these are called excitatory neurotransmitters. But there are others which can close the ion channels and prevent an electrical message from going through, and these are called inhibitory neurotransmitters. The main excitatory neurotransmitter in the brain is glutamate. Glutamate binds to NMDA receptors, which tell the cell to open up calcium ion channels. Since calcium has a positive charge, it makes the inside of the cell more positive, and that helps trigger an action potential. On the flip side, the main inhibitory neurotransmitter in the brain is GABA. GABA binds to GABA receptors, which tell the cell to open up chloride ion channels. Since chloride has a negative charge, it makes the inside of a cell more negative, and that inhibits an action potential. During a seizure, large groups of neurons become active synchronously, meaning all at the same time. And in a febrile seizure, the trigger for that neuronal activity is a fever. So that makes you wonder, why? Well, we actually don't know for sure, but there are some possible explanations. The first is that a fever raises the core body temperature, and it makes neurons more excitable than usual, meaning that action potentials are more likely to happen. The second is that fever causes hyperventilation, which is when you breathe faster and have a decreased level of carbon dioxide in the blood. That leads to a respiratory alkalosis, or an increase in blood pH, which also seems to make neurons more excitable. The third is that fevers are caused by cytokines like interleukin-1 beta that get released by white blood cells during the body's innate immune response. Cytokines are thought to also enhance the activity of NMDA receptors. Of course, most of the time people have fevers without having seizures, so these factors are just one part of the story. While we don't know for sure what causes febrile seizures, we do know that there are certain risk factors. Genetics seem to play a role, as children whose parents had febrile seizures are more likely to also have them. Age seems to also be a factor, because although febrile seizures happen in children between the age of 6 months to 5 years, the majority happen in children that are 12 to 18 months of age. Generally speaking, febrile seizures happen more often when the fevers develop rapidly, or are higher in magnitude. Febrile seizures seem to be more associated with some infections like human herpes virus 6, which causes roseola. Febrile seizures can also develop after vaccinations that really stimulate the immune system, like the measles, mumps, rubella, varicella vaccine. But the frequency is quite low, and the benefits of vaccination outweigh its risk. Febrile seizures also always involve a high temperature, or fever, of above 38 degrees Celsius or 100.4 degrees Fahrenheit. And they can be classified as either simple or complex. A simple febrile seizure lasts for less than 15 minutes, affects the whole body, and doesn't repeat within 24 hours. A complex febrile seizure is one that lasts for over 15 minutes or affects a specific part of the body which corresponds to a specific part of the brain, or one that repeats within 24 hours. Basically, if a seizure doesn't meet the criteria for being considered simple, then it's considered complex. Having said that, most febrile seizures are simple febrile seizures that last a couple of minutes, and they're tonic-clonic, which means that there's a tonic phase when muscles throughout the body suddenly tense up and go rigid, followed by a clonic phase when muscles rapidly start contracting and relaxing, causing convulsions. After the seizure itself, there's usually a post-ictal state, which is when a child might feel confused and may not remember the episode. They can also have residual arm or leg weakness. Treatment isn't needed for most febrile seizures, because they usually stop by themselves. During a febrile seizure, it's a good idea to lay a child on their side and keep track of the time. It's a bit more concerning if a seizure lasts for a long time or if there are other serious symptoms, like vomiting, trouble breathing, or a stiff neck. Oftentimes, it's important to distinguish febrile seizures from other underlying causes of fevers and seizures, like encephalitis and meningitis, which are infections of the brain and the tissue surrounding the brain. In young infants, a lumbar puncture can be helpful in identifying the underlying cause of the seizure. In some cases, anti-seizure medication can be used, but typically they're not needed in cases of simple febrile seizures. Finally, the fever itself can be uncomfortable for a child, so antipyretic medications like ibuprofen or acetaminophen can be used to reduce the fever. Alright, as a quick recap. Febrile seizures are seizures that happen together with a fever in children. Whether it's through an increase in body temperature, the alkalosis of the blood, or the release of certain chemicals like interleukin 1 beta, fever seems to excite neuronal activity, which makes it easy for groups of neurons to start firing simultaneously, over and over again. Most febrile seizures are generalized tonic-clonic seizures that cause stiffness, jerking, and loss of consciousness. Thankfully, most febrile seizures resolve themselves without any treatment and don't cause any long-term harm.
Hi everyone, thanks for watching that video on febrile seizures. I'm Sam, and I did the illustrations for this video. The script was written by Thomas, edited by Rishi and Yifan, Tanner did the voiceover, and Evan edited the video. If you're a parent or a family member of a child who gets febrile seizures, I hope that this video gave you the knowledge you needed and hopefully brought you some peace of mind. If you're a student, I really hope you found it informative. If you're looking for more videos like this to increase your study power, I would highly recommend you head over to osmosis.org and become a Prime member. That'll give you access to some great study tools and lots more videos that are not on YouTube. That's all from me. Later, guys.